Okay,
Hmm.
so random one-off question. Did COVID change compliance at all, like state to state? I mean, how much did it impact things and has it swung back to normal or is it just still impacted however it was?
So COVID for me kind of got me, selfishly, it got me out there more, right? Everyone started fit testing the N95s. I think that became something that people were aware of, right? Nobody knew those existed before and that you had to fit test them. What the beauty of what COVID did was it got most offices to get stuff off the counter, right? So like I used to go in an office and there was
Mm.
all this stuff on the counter and all these things, and you'd have to, I mean, you can't disinfect gauze that's sitting out on the counter. And it got everyone to put everything in the drawers, right? And clean everything up, which was amazing and wonderful to see. It also kind of got people aware that there was such a thing as infection control and, really focusing on PPE and that kind of stuff. I would sort of agree with you if you were alluding to that. It's kind of people aren't really as interested, right? I mean,
Yeah.
I
Yeah.
definitely am seeing things sort of come back to where they were almost in a little bit backwards. I always, in my infection control classes, I always talk about like PPE and how to wear it and when to wear it and why to wear it and that kind of stuff. But I think people sort of almost forgot like what we used to do, right? So like people aren't wearing masks or aren't wearing eyewear because they forgot that we used to do that. I think they all think it was a COVID thing. So that the sort of re-educating that, okay, there's these baselines and this is why we did so well during COVID. It's because we used to do this, and kind of keeping those things. In general, COVID kind of opened people's eyes, I feel like, to my world.
Yeah, I wondered about that. I think this is a compliance thing, but I can't tell you, ironically, if it's a real rule in Indiana, like the protective outerwear, lab coats, and things like that in the office. I think in Indiana, because it was every office I worked at, not everybody did it, you had to have a disposable gown. Like I worked in a children's pediatric clinic in a hospital. We had disposable gowns that had to be sterilized. You took it off, sterilize it. You weren't allowed to walk out in anything that you wore in the clinic. But in regular dental offices, we had lab coats. The dentist was supposed to pay for those, and they went into the washing machine at the dental office. You did not wear that home unless you were changing your scrubs at the dental office.